Yeah.
Right.
That takes money, that, but that's
Good morning. I'd like to call the Health Services Committee meeting to order on this, the 22nd day of August. And first thing on the agenda is we need the approval of last month's meeting. Would like to make that motion? Supervisor McDevitt, seconded by Supervisor Tarachi. Any additions or corrections to the minutes?
I'll abstain. I wasn't present.
Okay, thank you. All right, we'll vote. All those in favor? Aye. Opposed? Carried. Thank you. And with that, Rob, we'll turn it over to you. Good morning.
Just have a couple of brief items. First item I wanted to share with the committee was a second quarter expense report for our court-ordered competency restoration expenses. I know this has been kind of a wild card in our budget, over the last few years, and had to dip into fund balance and such to cover it. So I wanted to keep the committee apprised this year of where we are. I included a first quarter report that's revised because when the actual bills came in, it was a little bit less than we thought. So the first quarter was a little bit less than I had reported last time. So the first quarter was 69,559.04. We had originally budgeted for the year 40,000 in this line, but earlier this year, the decision was made to move 300,000 additional into the line. So we have budgeted in this line 340,000 for the year. Second quarter, you can see the expenses each month. What I've done is I listed the individuals up there, and that's their total chargeback expenses for each the number of days that they're in the facility. And then below are the examiner's expenses, during the each month. And so now second quarter totaled 155,745.27, brings this year to date total to 225,303. That's through June. So see how the rest of the year goes. You never know. We never know if we won't have any more, if these folks will still be in there. A lot of unknowns there. Questions on that?
Again, these are court-ordered mandates, so
Yeah, these are felony level offenders that there's a question about their competency to stand trial.
Anyone else with any questions? No? Hey, Rob, go ahead.
Okay, then second item was just an informational update on the Arpa behavioral health applications. We did end up receiving looks like 14 applications related to behavioral health, totaling almost $4.5 million. And so we have an ad hoc committee set up out of the Community Services Board. There was a $1 million set aside for behavioral health. So they will be reviewing and scoring applications and engaging in a process for selection. Questions on that?
Anyone have any questions for Mr. York? Anyone in the audience with a question? Not, then I guess we're good. Thank you very much, Rob.
Okay, thank
Have
you.
a good day.
Yep.
Good morning, Dee. I guess you're there on Zoom.
Yes, good morning.
Okay, we're all set.
Okay. The first item on our agenda is permission to amend our contract with Countryside Adult Home to increase the cost per meal reimbursement from $4.50 a meal to $5 a meal effective October 1st, 2021 or 2022. And this is due to the increased cost of food and supply items.
All right, would someone like to bring that motion to the floor? Supervisor McDevitt?
I will.
Seconded by Supervisor Hogan. Any discussion on that? All right, then, all in favor?
Aye.
Aye. Opposed?
Aye.
Thank you, Andrea. All right, carried. Thank you. D number 2.
The second item is permission to fill the meal site cook number 10 position. This is at our Johnsburg meal site location due to resignation effective today. The person in this position needed to take a full-time position elsewhere with a higher salary, even with the increase that we just did. This is a grade 2, 25 hours a week. It is typically 90% reimbursable by the state, but with our county overmatch, that varies depending on what we get for funding each year.
Would someone like to make that motion? Supervisor Conover,
I
second.
will.
Supervisor Geraci. Any discussion?
I have a question.
Yes, Supervisor Hogan.
Thank you. D, will you be hiring at the new increased rate or hiring at minimum wage?
The current rate of, I believe it's $17.04 an hour, which is the grade 2 rate.
Okay. And it's a 25-hour position.
Yes.
Just confirming. Okay, great. Thank you.
All right, any other questions? All right, let's vote. All those in favor? Aye. Opposed? Carried. Thank you. D, anything else for us?
I just wanted to mention 2 items. They're not on the agenda. The first one is we still have farmers market coupons for our seniors. Anybody that is eligible that is 60 years of age or older can come into our office or reach out to us and we can send them the paperwork via mail, email. It also went out with our newsletter. They fill out the paperwork and then we can either send them the coupons in the mail as well. They are $5 coupons, so a total of $25 that they can use at the farmers markets for fresh produce. They can also stop into the office and pick them up. And then I can email this information out to all of the supervisors as well if you would like me to, so that you can have it to distribute to. And then the other thing that I wanted to mention is that I recently had to do my vehicle registration. So I reached out to Pam just to make sure that this is something that was a higher reimbursement for the county if I did it in person, and it was. So I booked an appointment online, had it made for the next day, and it was a very simple process and very fast. So I just wanted to mention that because I know there's been some questions about that recently with the difficulty of it, and it was very simple, very easy.
Thank you, Dee. We appreciate you telling us that. All right, any committee member have a question for Dee? No, we're good? Okay. Dee, go ahead. Or was that Andrea?
I have a quick question. Dee, is there any way next year that we could have the actual sign up for the senior market coupons happening in town halls? Does it have to be centralized?
We could possibly work on it depending on staff availability.
Well, I was saying, like, can our administrative staff assist you in any way in this? I just know that, our seniors might not, well, particularly in communities like mine and Edna's, they probably aren't going to get down to you, but also, as a point of information, our administrative staff could be telling people about this program and then signing them up immediately.
Unfortunately, this is a very regulated process by the state, so we can't give the actual coupon booklets out to anybody else to distribute. We could give you all the paperwork, and then we could mail the booklets directly to the individuals at their homes. So we can do that, and we can do that right now. So like I said, I could forward all the documents that they need to complete. I could email it to each of you so that you could have it to distribute to the individuals. But the actual coupon booklets, we can't pass them out to any other people because it's very highly regulated. We have to track every single booklet that we have and that we receive.
Okay, I think if we just at least have the paperwork, it will be helpful.
Yep, absolutely. I can send that to each of you.
Thank you.
Good idea. Thank you, Supervisor Hogan. All right, Dee, anything else?
That's it. Thank you.
Thank you. Have a good rest of your day.
You as well.
Thank you. Good morning, Janelle.
Good morning, everybody. Happy Monday.
Thank you.
So my first resolution request is to amend Resolution 479 of 2021 and contract with Waystar, which is AKA Zermed, with home care and our public health immunization program accounts to reflect a 7% rate increase for services including annual assessment fee, claims management fees, eligibility verification fees, electronic remittance advance fees, and authorize automatic renewal unless the annual rate increase is over 10% or there's a 30-day written termination notice rendered by either party. This contract is renewed annually for the purposes of verifying insurance before billing to expedite claims without denials.
All right. Would someone like to move that motion? Supervisor Conover, seconded by Supervisor McDevitt. Any questions for Janelle on this? No? All right, then we'll vote on it. All those in favor?
Aye.
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 Opposed? Carried. Thank you. Next one, Janelle.
Okay, the second is to amend Resolution 510 of 2014 to increase the rates for our certified home health agency. Our rates have not been increased for several years, and the new rates will reflect our current costs, which will also increase our revenue.
All right, would someone like to make that motion, bring it to the floor? Supervisor McDevitt, seconded by Supervisor Conover. Again, any questions for Janelle on this resolution?
I do have a question.
Go ahead.
Thank you. Can you explain the payments for these rates?
Okay, so what usually happens is we do a cost report to determine what the cost of our actual visits are. And that's the cost that then we would claim for insurance billing. Our cost has been significantly lower for a long period of time, even though our cost rate has gone up. But basically it would be an insurance charge. If there is any private pay, it's done on a sliding fee scale and usually a very small percentage of that visit fee. Did I answer your question?
Yeah, I was concerned about the private pay for people who don't have insurance for whatever reason, that there is a sliding scale. Is that reflected in some other policy document than this?
Yes, we have a sliding fee scale policy and procedure. It's a very small percentage of our patients, but we do work with them and we do provide free care as well should somebody qualify.
What's the qualification
I would
cutoff,
have,
do you know?
I would have to get the policy and I can forward it out if you want, but I
Yeah,
have that
you
number
can-
on the top of my head because we don't use it too frequently.
We do use the guidelines that are by the state for income eligibility like DSS uses. So we update that every January when they put out the new rates of the income guidelines based on the number of people, based on the family, based on the income. So it might be usually I think the lowest is at a 10% of the fee, and then it goes up to 20, 25 based on whatever, whether it's a copay or whether it's full payment. And like she said, we have very few people who are self-paying, don't have insurance. And the ones that do have insurance or can't fill out our forms when we meet with initially with a patient and they say, I can't afford my copays, or so we have them fill out the information. We go through that guideline.
And actually, it came back to me, it's the federal poverty guideline
Yes.
scale that we use
Yeah.
every year.
Thank you.
On and Janelle for that explanation. All right, all those in favor then?
Aye.
Aye. Opposed?
Aye.
Thank you. Carried. All right, the next one, Janelle.
I will turn it over to Ton for resolution number 3.
Okay.
This is just to update our current budget revenues and expenses for the COVID vaccine response contract. The initial grant is for $183,683.11. And when the beginning of the year, because we hadn't closed the books, I didn't know, so I just moved and created it for the new year, 150,000 to move over, just so we could continue paying expenses out of that. And doing an analysis, we spent 87,000, or where is it? $82,307.88 last year. So the balance for this year right now should be $101,375.23. And I had moved over 150, so I'm just reducing it by $48,624.77. So I'm reducing the revenue, and then I reduce salaries, some advertising, and the fringe related to those salaries.
All right, makes sense. Motion made by Supervisor Conover, seconded by Supervisor Geraci. Any questions? All right, all those in favor? Aye. Opposed?
Aye.
Thank you. Carried. All right, we'll move right along. Janelle?
Right, I believe Samantha was gonna pass out an updated resolution request that was a late breaker from Friday night based on conversation with the county attorney's office. Resolution number 4 is to authorize the Director of Health Services to enter an agreement with retired and senior volunteer program of Warren and Washington counties with automatic annual renewal unless 30-day written termination notice is rendered by either party. This agency's been providing items that are made by the seniors, like hats and blankets and booties and things like that for our WIC clients. We had a previous resolution 459 of 2016, and by supporting this, it'll allow us to continue to utilize their gifts and credit them with volunteer hours for RSVP.
All right, sounds like a good thing. Could someone make that motion, please? Supervisor?
I will.
Seconded by Supervisor Hogan. All right, any discussion, any questions? If not, we'll vote on it then. All those in favor? Aye. Opposed? Carried. Thank you.
All right, and back on track. I'll turn it back over to Ton for our report of revenues and expenditures and also the comparison report.
All right, thank you.
Okay, attachment number 4 is our comparison as of August 11th. Again, we've closed the month of June for our home care and others. You can see that we are at 33.85% of the budget in salaries, where last year at this time we were at 59.21%. Majority of it is in our part-time salaries because of course we had contact tracers, and we obviously with everything changing, and we still have contact tracers, but not as many. The same with overtime related to all that, and our staff that had to go through everything with COVID last year. And our full-time salaries are primarily related to our home care division, where, like, as we've said, our nursing staff is down to 6 nurses, where it was more last year. So most of that is revenue regarding that. On attachment 5, which is our comparison from last year to this year, just to give you a snapshot at that time. Our revenues again are down, and one thing to just note, which we know every month, is that we're getting back into some clinics, not as much as we normally do, but we are doing rabies clinics, I think like once a month right now into the fall. That is a revenue earning. We get donations. We don't ask for anything in particular. It's what anyone can afford, but all that is applied, and then we have to apply that to the grant to offset our costs for the clinics. I think they're going to be getting into flu clinics. Again, it's going to be due to staffing, what we can do, but they're scheduling that. And again, that is a revenue earning. At this point, I believe we're not doing any travel clinic or any STD clinic. STD clinic is a free clinic. It is state aidable, but at this point, we're not doing anything with that. And our travel clinic right now, we are not doing anything with that either. And that would only be a revenue earning in some point, not necessarily a what do I say, a profit. So the travel clinic is something we've looked at, whether to continue with that anyway. But so those things are what we reflect in here.
Just to quickly follow up with regard to Ton's statement on the travel clinic. One of the shots that we give, or immunization, shall I say, is the yellow fever, and there's been a shortage of that for some time. So when people have to go to places that require that yellow fever, we have to refer them to other spots. And one of the goals of our travel clinic has always been that it not cost the taxpayer any money because it isn't state aidable. And so anyway, because we have to refer people to another place, it's kind of silly to have them come here to get 2 or 3 shots and then go to another place and pay extra expenses there. With regard to the STD clinic, with COVID, that obviously we weren't having face-to-face clinics and weren't open to the public. However, just on Friday, you approved a resolution to allow us to enter a contract with Hudson Headwaters to provide STD services and TB services. So we will be starting that clinic up as soon as we work out some logistical issues. But in the interim, we were serving people on a case-by-case basis. We just weren't having the clinic, so to speak. But if anybody called and looking for services, we were able to address them on a case-by-case basis. Were you done, Tom? Yep. So we have all of our regular attachments. Worth noting on the rabies attachment is an upcoming rabies clinic on the 17th at the Chester Firehouse. So just kind of want to bring note to that. And then also on our agenda, I know we've changed the travel and education policy up a little bit, but just thought I would announce that we have a webinar that Val Wisenat, our Assistant Director of Patient Services, will be participating in through Home Care Association. It's on emergency preparedness. The cost is $159 and the funding is in the budget. In addition, in October, I'm going to be attending the annual NYSHO Public Health Leader Summit in Clayton, New York from October 11th to 13th. The conference and the lodging are totally offered at no cost to the county. It's just the travel out and back, and that's offered through NYSHO. So I thought I would mention that. And with the referral of pending items, we don't have any. And that brings us up to privilege of the floor. And I don't know if you want to offer up to the public before I have my discussion item, or if you want me to continue.
All right, well, let's just see, does any committee member have any question? No questions? Anybody in the audience have a question for Janelle? All right, Janelle, let's just go on to your electronic medical record RFA.
I just wanted to bring you to the attention. We've been working with the county attorney's office. We've been working with other home care agencies. We've been working with vendors of medical records, and we've been working with Julie and purchasing, and we've been working with IT to try to set up an RFA or RFP for us to put out for a new electronic medical record. Our current contract will expire in March of 2023, and we just want to look to see that we're getting the best price, the best service, things like that. So I just wanted to bring it to the committee's attention that we'll be seeking RFA. We're working with purchasing to make sure that we're following all the right rules. Then we'll be hopefully coming back to you with a responsible bidder that, you know, will help us improve our medical record and improve the staff time working on the documentation, and hopefully will cost less money as well. So just bringing you abreast to that. And oh, Ton just whispered in my ear, the good news is the bulk of the expense will be able to use district funding for, which we have over $200,000 in that bucket. So hopefully it won't cost the county too much for us to convert.
Hey, that is good news. All right, thank you. Anything else?
That is all for me.
All right, committee is good. No one has any questions? Supervisor McDevitt.
I just have a general question for him. Maybe Janelle can answer. In terms of national news, there's been a lot of information being spread around in regards to polio. In parts of New York City, for example, there seems to be an increase in a disease that, when I was a kid growing up, was prevalent and has gone away. But it appears to be coming back in pockets, particularly in the Hasidic community in the New York City area. But maybe you could kind of give us a little update if you have any, Janelle, on that.
So you're correct in that there have been some polio cases, and we had seen a drastic decrease and hadn't been having polio cases, I think, since maybe 70s, 80s in our in the United States. There are pockets where there are unvaccinated communities that are more vulnerable to this. And that's kind of, I believe, what you were referencing. It was picked up initially on wastewater surveillance. It's thought that it might have been there a little bit longer. I think around 75% of the cases are asymptomatic, but there is a current case that's pretty sad about a young adult that has come down with this and is suffering the paralysis that we're not thinking he'll recover from, he or she. As far as our community, we have a high vaccination rate. And right now, New York State is recommending for those that, might, are unsure of their vaccination status, that they can talk to their providers. But for right now, it's really only recommended that you get a polio vaccine if you've come in direct contact with one of these cases or in some other, circumstances. So I would just encourage people to just communicate with their providers. But like you said, our vaccination in our community is pretty good. So hopefully we won't see this going crazy in Warren County. But we're definitely keeping an eye on things.
Thank you, Janelle.
Thank you. Any other questions? All right, any public comment, Mr. Lehman? Assuming that's a no. And we would like to entertain a motion to adjourn. Supervisor Conover, seconded by Supervisor Geraci. Any discussion? All right, all those in favor? Aye. Opposed?
Aye.